Nursing has taught me how to advocate for my patients, which in turn has taught me how to advocate for myself. My name is Susan Archibald, and I'm an RN, registered nurse. Becoming a nurse was a very late career choice, but a much needed one. I needed to help others. My birth parents are actually from Moose Cree First Nations. I am a Sixties Scoop survivor. I was taken at birth from my birth mother and placed into a foster home. And I don't even think she actually got to hold me. Sorry. Not many people know about the Sixties Scoop. I had actually gone through 5 families by the age of 2.5. The biggest challenge within my nursing career has been assumptions from other staff, assuming that I know all of Indigenous culture, Indigenous resources. I don't have the knowledge. I don't have the connections that I would have had having that denied from me. Prior to me becoming a nurse, I was a patient. I definitely know I've been treated differently. One of my worst experiences that I had, I was delirious. My husband was very concerned, brought in, triaged, waited in the emerge for 2 hours out the front, and then I was brought back to the back for another 2 hours. My husband overheard the triage nurse say, she's not urgent, she's probably just recovering from a hangover. When the doctor finally came in to see me, made a diagnosis of saying she has meningitis, I could have died. They just felt that I wasn't an urgent patient. They just assumed that because I am Indigenous, I was drunk. So out of that experience, unfortunately, I now dress up when I'm sick. I make sure I'm neat and my hair is well done, which I shouldn't have to. Becoming a nurse was important to me. I want to include everybody and make sure that they are not seen any differently than another person. I want to ensure that they realize how important they are. So previous to my position, I used to work in the community as a community nurse. I've also worked at many other sites. So going on 11 years, I actually really love my job. Despite my experiences within the healthcare system, I'm really settling into my role. I think it's because I'm learning more about my culture. I'm healing from my experiences. Part of the systemic problem is the fact that nurses are burnt out. There's not enough nurses to care for patients. So they don't have that extra time to spend with their patients to understand fully. This is where we end up having biases. My approach is very different. It's very gentle. I hear, I listen, I speak directly. See the person, not the problem. Treat them like a human. We're all the same. We have a different color, but we're all the same.